Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Welcome to Fronteras, a changing America. I'm Johnny Coker. The opioid crisis continues to ravage communities across the United States, including here in New Mexico. According to data from the New Mexico Department of Health, there were 948 overdose deaths in 2023, with roughly 65% of those overdoses involving fentanyl. In an effort to bring these numbers down, some in the local community are calling for what's known as a safe use facility, also known as an overdose prevention center. I have more in this report. With opioid settlement funding coming to southern New Mexico, local governments are debating how to best use the incoming money. Like so many areas of the United States, the city of Las Cruces and surrounding communities have been devastated by the opioid epidemic. According to 2022 data from the Centers for Disease Control, New Mexico ranks 7th in terms of overdose mortality rate across the entire nation. But some public health experts in Las Cruces are saying that safe use facilities could be a good step in reducing that rate. Safe use facilities, also known as overdose prevention centers, are areas where individuals are medically supervised while using substances and are connected to other services that could help them overcome their addiction. Local public health experts Philip Feudy and Athena Huckaby are in favor of bringing a facility to the city, with Feudy saying that the center would not only reduce drug-related deaths, but could remedy other issues in the community.
Where these have been successfully implemented in, ironically, maybe meeting the needs of the immediate community that was most opposed to them.
The city of Las Cruces is slated to receive roughly $10 million through 2038 stemming from settlements from pharmaceutical companies, while Doña Ana County will receive roughly $14.5 million in settlement funding. Feudy said he believes many pieces are already in place in terms of implementing an overdose prevention site in Las Cruces.
I really think that if this is a crisis, it would be great if people would treat it as such and be willing to take some risks and do something a little different than we've always done.
Huckaby echoed Feudy's sentiment and said she hopes the city's open to doing a pilot project to let the results of an overdose prevention site speak for itself.
The finger gets pointed at individuals that are ending up caught in these systems instead of the systems. And I'm always trying to call people's attention back to the systems that cause these problems. And I think people find it so much easier to blame individuals.
But the idea of an overdose prevention center has some community members speaking publicly against the concept, including local business owner Vic Villalobos. Villalobos has had issues with his property being burglarized in the past and said he would like to see the city and state focus on crime enforcement rather than overdose prevention facilities.
You're not solving a problem, you're putting a Band-Aid on it. When the real problem is enforce illegal drug use, enforce all these criminal acts, right? I mean, people are still committing crimes, they're still, assaulting people, and there is little to no consequences, and not by any fault by our police department because they're trying to enforce things, but by the time it gets to a court system, you're back out on the street again.
But despite the pushback, some in the community see the sites as a step in the right direction. Ryan Brewer is the founder and CEO of Zia Recovery Center and said he believes that overdose prevention facilities could have a net benefit if they follow the same model as other successful facilities found in other states.
If you look at the data, the good safe use sites that are set up around the country, they are a link between the drug addict and good treatment. Sometimes it just takes some time for that drug addict to get through that phase to where they eventually go to treatment to improve their quality of life and get off the drugs so they're not a burden on society anymore. I do think it would have a positive net effect if it's done correctly.
According to the National Institutes of Health, studies have found that these types of facilities are associated with reduction in public drug use and could reduce pressure on local emergency responders and healthcare systems. Brewer said that while an overdose prevention site could help Las Cruces, it's important that the city and the state continue putting resources toward auxiliary services to help ease the effects of the opioid crisis.
There's a lot of addiction problems in this town. There's not enough beds in this town. There's not enough resources in this town. There's not enough money in this town right now to help with this massive problem that we're seeing.
According to City Councilor Becky Corin, getting resources in the right places in a timely manner is important for helping the people that need it most urgently. The District 5 counselor, who also works as a public health professor at Doña Ana Community College, said she would like to see opioid funding be spent on harm reduction programs that could have an immediate positive impact on the community.
I think that those pathways being immediately available and accessible and funded is what I'm hoping that we can invest in. Harm reduction and pathways to substance use reduction for people who want to engage in that process.
Counselor Corin said that while she believes in the data that show positive results for overdose prevention centers, it could take time to set up a center for the city, especially when considering how the state would view the legality of such a facility.
In our conversations about the opioid settlement funds, and there has been a lot of outreach to folks in the community, this was not one of the named things that people said was a priority to them. They really are interested in one-on-one sort of harm reductions. It isn't the thing that's at the top of the list, but I think we're open to all things that will help people and help save lives. So that's why it needs to be part of our considerations.
As Southern New Mexico wrestles with the ongoing opioid crisis, the debate on overdose prevention centers highlights a disagreement within the community, and implementing such a model may hinge on finding common ground among divided stakeholders. And now joining me in studio to talk about the ongoing opioid crisis and solutions surrounding the topic is local public health professional Athena Huckaby. Athena, thanks so much for joining us in the studio today.
Thanks, Johnny, for having me.
So tell me about your journey into public health and harm reduction. Tell us a little bit about your background for folks who don't know who you are and what you do in this region.
Sure. That's a good question. I graduated from the City University of New York. I'm not from New York, I'm from Illinois, but I ended up going to school there, and as part of your work, you have to do, a practicum, right? You have to think about what you're interested in studying. And I had been working with a grassroots organization called the Sex Workers Project that dealt with sex worker advocacy and rights, and also harm reduction. So that was specifically through a lens of sex work rather than drug use, but you can imagine that there's a lot of overlap.
Sure.
Right?
Sure. And so what led you to New Mexico? What did that journey look like that led you from, Illinois to New York, and then now you're in southern New Mexico? What did that journey look like?
Sure. I had moved to Phoenix, actually, when I was 19 from Virginia. I've lived in a lot of places, and I really enjoyed the Southwest, but I didn't want to move back to Arizona. And after doing some research around New Mexico and the different health initiatives that were going on here, I decided that it would be a good place to land. I didn't know initially if I would be able to find work here in Las Cruces. I thought I might have to move to Santa Fe or Albuquerque, but I quickly got a job with the Doña Ana County Health Department, and I started out delivering summer lunches and then moved on to working with the new grant that they had doing naloxone distribution and education, and that was in 2017.
And so there certainly is somewhat of a lack of resources when it comes to harm reduction in New Mexico, it seems like, but specifically in the southern part of the state. So, what specific harm reduction strategies are currently happening here in southern New Mexico that you wish more people knew about? What is your pitch to the community about what is going on in terms of public health and the things that you advocate for?
So actually what I think is really interesting about New Mexico as compared especially to our neighbors is that we actually are very innovative in respect to harm reduction. Syringe exchange, for example, is still not legal in the state of Texas. And in Arizona, it's legal but not supported. So meaning that, grassroots organizations can do syringe exchange and not be prosecuted, but it's not supported by, the state health department. Here in New Mexico, harm reduction was enshrined into law back in 1997 with the Harm Reduction Act. So we've had syringe exchange, naloxone distribution since 2001, lots of programming through New Mexico Department of Health around this, and we were the first state to pass the Good Samaritan law, the overdose immunity law. That was in 2007. So I think what people aren't aware of is that New Mexico is actually very innovative as compared to many other states when it comes to harm reduction.
And New Mexico is innovative, and like you said, the Department of Health does have these harm reduction programs that many other states do not. But are there some things, like on your wish list, that you wish Southern New Mexico and maybe New Mexico in general had in terms of these programs that would make it easier for individuals, experiencing substance use disorders to help them overcome that?
Sure. So, both New York and I believe Rhode Island, Rhode Island's maybe getting up here momentarily, but New York specifically has what's called an overdose prevention center. They have 2 of those. Those are where people are able to bring drugs that they have purchased elsewhere into the site and use in a safe manner with access to naloxone and oxygen. And this has been very helpful in preventing overdoses. And I also like to point out in getting open air drug use off the street. People don't like to see people smoking fentanyl or using drugs out in public. And it's a really good way to avoid that, right? Give people somewhere to go. And that way they're not in parks, they're not on bus stops.
And we've spoken about this in the past, the Overdose Prevention Center. What's your elevator pitch to people that don't know what this type of thing is or feel like it might bring more drugs into the community? Like, what's your pitch to people that don't know what these things are or what they could actually do for the community?
Sure. I would say that, first thing is that what harm reduction seeks to do is to reduce harms for behavior that's already happening, right? I think that if anybody tries to say that there's not drug use going on in the community currently, that they're probably not well informed. I think we all see that. So what we're seeking to do is reduce the harms of choices that people are already making. I don't know a single person that has decided that they would like to become an injection drug user because the state of New Mexico provides clean syringes, right? I don't think that is what motivates people to make choices in their lives. I think when people have already gotten to a point of chaotic drug use, that what we can seek to do is reduce the harm that's coming from that.
I see. And you have many titles within the community and as a public health professional, but you are part of the Opioid Settlement Advisory Council that was created between Doña Ana County and the city of Las Cruces. Tell me about your role in that and discussions that are happening within that council and how best to use incoming funding from opioid settlement funds to overcome the crisis that we're facing as a community.
Sure. I was appointed to that council or that body because I chair a group here in Doña Ana called the Opioid 360 Plus Committee. So that's a group of everybody in the community that's doing prevention work, treatment work, recovery support work, and harm reduction work. So all of those folks are at the table. We meet monthly, usually on Zoom, but once a quarter we meet in person. So my role on the advisory council is not just to, say what I think, right? It's to bring the voice and the opinions of everybody that's on the Opioid 360. So that's really who I'm representing when I'm there. And sorry, what was your second part of that question?
Well,
and
what kind of conversations are happening on that council? Have you spoken about the overdose prevention centers, or what kind of ideas are coming out of it in terms of how the community can overcome, the crisis that comes with the opioid crisis in general?
So I think that the conversation right now is that we want to have actions that we think will be impactful, that we can link with measurable outcomes. So, it can be challenging because, of course, the community wants to make sure that that money is spent responsibly. And one of the ways to make sure that that money is spent responsibly is to attach it to outcomes. You know, if we spend it on, let's say, linking families, let's say, to substance use treatment, which is something that we've been talking about. How are we going to measure whether that was impactful? Is it the number of families that engage in the services? Is it the number of families that remain in services for a particular period of time? Is it the number of families that are able to achieve some other measurable outcome like stable housing or right? Like there's a lot of ways to measure things.
Right.
And so I think we're talking about responsible ways to measure the things that we would like to do. I mean, I think it's great to say we want to eliminate the opioid crisis, but you know, there's a lot of ways to measure that. So I think that's kind of where we're at right now, is trying to figure out what outcomes go with what measures. As far as the overdose prevention centers, that's not really a conversation that's necessarily been happening at that. I mean, of course I talk about it because I'm interested in talking about it, but, and there are members of the Opioid 360 that are interested in talking about it as well, but I don't think that's necessarily a huge push on that council at this time.
I see. And so you talk about measuring certain outcomes of programs. I guess my follow-up question to what you just said is, what is a good way to measure outcomes to figure out what the best way to spend this money is? Like, are pilot programs a good way to begin to start like proof of concept with some of these programs? Like, how do you measure outcomes?
I mean, that's a really great question, and probably, you know, unfortunately I didn't focus, I have a little bit of background in epidemiology, but I'm not an epidemiologist. I feel like that's definitely a question for somebody who, there's a whole field of study that seeks to answer that question. I think for me, as far as measuring things, there's all different kinds of creative ways to do it. I feel like that that makes me want to talk about my role at Ideal Option as the community outreach coordinator. We, for example, publish our outcomes, our New Mexico outcomes, yearly in a report that we make public. One of the ways that we measure whether people are being successful in treatment is whether they're adhering to their medications that we're prescribing for them, which I think is great. Right? That's a really interesting way to measure that. Whereas, you know, if you think about how many people remained in our program for a year or how many people remained in it for 2 years, I mean, really we want people to get, I don't know if that's a good measure, you know? And so this idea of like, we measure whether they're taking the medication that we're giving them and whether they're continuing to use illicit substances.
I see.
So that's a really great way to measure that. And we're one of the only companies, I think, in the nation that do drug treatment that makes our outcomes public.
And, you know, in past conversations that I've had with you, you mentioned one of the main barriers to access treatment or to overcome, you know, opioid addictions is housing. And I know that you have a housing fund. So can you just tell me like how that came about and how that relates to your work within the community?
Yeah, so myself and my colleague, Roxy Grajeda, were working, she was the, I believe she was the overdose prevention coordinator at that time at New Mexico Department of Health here in southern New Mexico, and I was the overdose prevention coordinator working in at the county, at Doña Ana County Health and Human Services. So what we kept both seeing in our work was that there was not only a lot of stigma related to people suffering from opioid use disorder, but there was a lot of stigma around taking one of the FDA-approved medications for that. So the two medications specifically, buprenorphine and methadone. So at that time, none of the sober living facilities in southern New Mexico would allow anyone on one of those medications to live there, which is a clear violation of the ADA, and you know, some organizations have, you know, changed that, right? And so now, for example, at the Oxford House here in southern New Mexico, one can be on one of those medications and live in an Oxford House. But that wasn't the case when we first started. And so we couldn't find any housing for our clients, our people. And so to say to someone, you have to choose between the FDA approved medication that's saving your life, that's proven to have good outcomes, or housing, right? That's not a fair choice to have people make. And so that was one of our motivating factors, but I think just altogether we saw that there was a huge gap in resources. I was dealing with a family, it was actually a grandmother of 4 that was staying at one of the local hotels housing her grandchildren that was set to be, she didn't have any money to pay that week and was going to be evicted and on the street with her 4 grandchildren. And I started calling churches, I called the Salvation Army, I called Community of Hope. Nobody had emergency funding at that time to house this family. And so I housed them. And then the fund sort of went from there.
And you talk about buprenorphine and methadone. How do you as a public health professional try to get away from the stigma of these medications, or try to overcome the stigma associated with these medications? Because like you said, it used to be to where you couldn't even get stable housing if you were on these medications. So as a public health professional, how do you try to get rid of that stigma of those medications?
So I think on 2 levels. I think number one, individual education and education with different groups and community agencies about the way that these medications work, their efficacy, how available they are, where people can get them, et cetera, right? Like try to give them the real scientific information about how these medications work. Yale came out with a study just last year that I think finally said the thing that we'd all been thinking, which is that abstinence-based treatment for opioid use disorder is actually worse for people than no treatment at all. So it actually, people statistically do better if they have an opioid use disorder. If you're not going to provide them with one of the FDA-approved medications, it's better to just leave that person alone rather than to put them in abstinence-based treatment. So I thought that was a very interesting study. I'm happy to send it to you. But trying to educate people on the studies, what the information is. And then I think on the other level is more of a systems level, which I'm also really interested in, making sure that all the systems align. So one of the problems is, let's say you've got somebody that's stable on their buprenorphine and they become incarcerated. Up until this year, depending on which jail they ended up in, their buprenorphine may or may not be continued. So if it's not continued, let's say at the Doña Ana County Detention Center, and they get out of jail, and then they're less stable and more likely to overdose than when they went in. So if we can get the jails providing the medication, the treatment centers in New Mexico providing the medication, and so that everything aligns, so that no matter where one of these patients ends up, they'll still get their buprenorphine. There's only one hospital in the county right now that will continue somebody on buprenorphine if they end up in the hospital.
Wow.
So imagine that you're stable on your insulin and you end up at the hospital because they broke your leg and they refuse to continue to give you your insulin. Right? That doesn't make any sense, but they do it for medications for opioid use disorder every day.
Wow. And Athena, we don't have a ton of time left, but I did want to ask about, with the legislative session right around the corner, what are some things that you would like legislators to be looking at in terms of the opioid crisis and harm reduction, and what could help you in your own profession in terms of helping turn this addiction crisis around for New Mexico in general?
Yeah, I think that one thing that's often really overlooked is the way that alcohol actually plays into this. Something like 40% of the opioid overdoses in the state of New Mexico also involve alcohol. And there's a lot of talk at the legislature this year. I just read an article by Ted Alcorn that hopefully this year we may finally be able to pass an increase in the alcohol tax, and that money could then be used for harm reduction measures around alcohol, which would be very interesting. So I think harm reduction is not just for opioids. It's for any type of substance use, any type of, it really can be applied, I think, to any issue in public health, not just opioids. But, certainly I would love to see, we're seeing this year in 2025, the legislation that was passed, I believe last session, that all of the jails and prisons in the state of New Mexico have to start providing buprenorphine to people, or medication-assisted treatment, to people in the jails and prisons. So I think that's going to solve a huge problem. I'm very excited about that. I'd like to see the same thing happen with hospitals and also with inpatient rehabilitation facilities for substances. I think that if you are an inpatient rehabilitation facility, a 30-day facility, let's say, that's taking people for opioid use disorder, you should be required to offer those medications if you take New Mexico Medicaid.
Well, Athena, unfortunately, we are out of time, but I want to thank you so much for coming in today to talk with us. Athena Huckaby is a public health professional in Las Cruces. We'll have you back on sometime. This was a great conversation.
Thank you. It was great to be here.
That's all for today's episode of Fronteras, A Changing America. Fronteras returns on March 27th in lieu of Season 19 of Your Legislators beginning next week. I'll be hosting lawmakers from the KRWG TV studios during New Mexico's 60-day legislative session, which is just days away. In the meantime, you can stay up to date on the latest local news at krwg.org. For all of us here at KRWG Public Media, I'm Johnny Coker, and we'll see you next time.